Hello beautiful people, welcome back to my channel. My name is Lucy and today we'll be discussing something very important, why it is very necessary for you to disclose all your health information to your healthcare provider. This will not only save your life but that of your baby. So please, if you're pregnant or you know someone who is, stay tuned. Pregnancy is a delicate journey and your healthcare provider need every detail of information that he or she can get from you in order to take better care of you and then plan your treatments. If you did not divulge all the things you know concerning your health, especially when you are pregnant, it might lead to several complications. And by telling your healthcare provider all that you know, it will also help your doctor or your midwife to prepare in terms of emergencies. For example, if you had previous surgery in your first or second pregnancy, if you take in again, it is mandatory you must divulge that information to your healthcare provider. I have seen a situation where a woman who has given birth before through cesarean section, twice even. So in her third pregnancy, she made up her mind not to give birth via cesarean section. She now changed hospital. So in her new hospital that have no history of her health conditions, she did not tell them that she had had cesarean section before. When she reached 40 weeks of gestation, heading to 41 weeks, she opted for induction. And they have just started that induction. Midway, she was complaining of pains. By rights, she's not supposed to go through SVD. Had it been she just did one cesarean section, maybe she would be advised to try labor, but that is trial of labor. But this one, she's done cesarean section twice, and she decided that she's not going to deliver via cesarean section again, that she must deliver through SVD. What saved her to that day was because during her discussion with a nurse, she was able to find out when she was doing palpation that she had a scar linked. So had it been she did not see that scar on her abdomen, she might end up losing both her life and the baby, because immediately contraction sets in. There is no how the uterus will not rupture, and when the uterus ruptures, the chances of the baby surviving, even the mother, is very slim. So it is very, very vital that you tell your healthcare provider all of this when you are pregnant, you decided to start your antenatal visit. Another reason why you must do this is this: if you are someone that have had preterm contraction in your previous pregnancy, maybe you have had miscarriage before, or during your first pregnancy you bled, it is mandatory you tell your healthcare provider so that he or she will be ready. Another instances I want to give is this: there is a woman I delivered not quite long ago. During her labor, she told me that she have had cervical laceration before. So after her delivery, which did not take time, she started bleeding profusely. But before that, she have made mention of her blood not clotting on time. So when we have gathered all this information, we are very ready to take care of her when the complications set in. She was immediately rushed to theater, and up front we provided 3 pints of blood that she received at the theater. Let's just assume that this woman hid all this information. What would have been the case? she might end up losing her life. So it is very, very important that you do this. Do not hide your information. If you've taken anything before presenting yourself to the doctor, please inform the doctor. If you are having pains, headache, anything, do not call any signs you are having during your pregnancy as very small. Nothing is too big, nothing is too small. You have to explain everything. Ask your questions. Tell your doctor everything. Even if you have taken any medical herbal mixture, tell your doctor you have taken herbal mixture. If you are having diabetes, or you've had your mother or your father had it, tell your doctor about it so that they will prepare upfront. If your BP used to be high, please tell your doctor about all these things. You're not only saving your life, you are also saving the life of your baby. If you have had, or if you are having infection, please say it out. HIV, hepatitis B, anything, say it out. By so doing, the healthcare provider will make an adequate arrangement for you. As we are different, that is how our individual circumstances are different. So the plan that the healthcare provider is going to provide for you is specifically for you based on what you've told your healthcare provider. He or she wouldn't know if you did not say all these things. So there is a need that doctor or your nurse, while they're taking care of you, especially during pregnancy, every damn information. What you cannot tell your husband or your relative or even your mother, please say it to your healthcare provider. It's for your life and the life of your baby. Again, there are some conditions that arise during pregnancy that does not have any symptoms, like preeclampsia. This particular condition is very, very dangerous and kills. So if you did not tell your healthcare provider that you've had something like that before, or that you are having a frontal headache, or you are feeling dizzy, all this information, they will not make proper arrangement for you. I want you to understand this. The information you are giving out is not to spread it. He or she is not going to spread the information or to mock you. You are giving that information in order to stay alive, and your baby will be alive. If you are HIV positive, tell your doctor. There are some hospitals that will have to carry out tests in order to find out. But even if that is not the case, the first contact you have with your care provider, please, it is necessary that you tell that health provider every damn thing. Even the things you think that doesn't matter, matters a lot. If in your previous pregnancy that it took time before the placenta was able to come out, tell your healthcare provider. If the placenta did not detach, then I have to do manual removal. Tell your healthcare provider. If at the point of delivery you were not able to push out your baby, that they use vacuum, tell your healthcare. Anything that happened in the previous pregnancy, and even if you've not given birth before, this is your first time, whatever it is you've encountered, you've heard, you have felt, you are feeling, tell your healthcare provider so that you can be managed well. What matters is this: at the end of everything, you will be safe and baby will be safe. Like and share. See you in my next video. Bye.